Hi guys, welcome back to our channel Millicent Moms. Hope you guys are doing well. Thank you so much for your supports which you are giving. We know that you guys are watching our videos, you guys are sharing it because we are getting lots of requests in our mails and all. So if you have any queries, if you have any suggestions and all, please do mail us. Our mail ID is millicentmoms08@gmail.com. And as I have mentioned in the previous video, we do have a WhatsApp group for the students, but make sure only students gives us a request to join in that group, because we are getting lots of requests to get joined in that group and we are making them join, but the thing is some people will not be active enough. Okay, so the main purpose of that group is to favor the students. Okay, so the students those who want to join our group, they can mail us and they can get joined in our WhatsApp group. Other than that, whatever queries you have, whatever feedbacks you want to give, don't hesitate to mail us on Millicent Moms, or you can comment in the comment box. Okay, and also please do share our videos. Okay, so today I have come with an anatomical session, that is skeletal system. Actually this is musculoskeletal system, but as it is a bit long session, I will not be dealing with the muscular system. Vidya will be dealing with that. I'll deal with the skeletal system. Okay, so in skeletal system, actually the human body consists of, as you all know, 206 bones. Okay, 206. This is the total number of bones in a human body. Okay, individual bones these are. Why I told it as individual bones? Because in childhood, that means in newborn babies, there are 300 bones. Okay, and these bones get fused together and it formulates as 206 individual bones, because many of the bones get fused together. So the number will come down to 206. Okay, and in the skeletal system, mainly this is divided into two parts. It is the axial skeleton and the appendicular skeleton. Axial skeleton means, with the term itself, you should identify that this is central portion. Okay, when you take a globe, there will be an axis for that, right? There is an axis for that globe. That means that is the center portion where the globe is getting holded, isn't it? So in the same manner, axial skeleton means what all things comes in the center portion of our body. That falls under it is the easy way to remember. Okay, that's why I'm telling like this. So what all falls as the center portion of our body, that falls under the axial skeletal system, and what all falls as the periphery, like the upper limbs, lower limbs, pelvic girdle and the pectoral girdle, all these things falls as the appendicular skeleton. Okay, so now we will deal with the individual things. Like in axial skeletal, there are many things: skull, hyoid bones, auditory ossicles, ribs, sternum and the vertebral column. So the first thing what I want to discuss is the skull. As you all know, it is the outer covering of the brain, the cranium. Cranium is the outer covering. The skull consists of 22 bones. Okay, in this 22 bones, the 21 bones are fused together. Okay, that means it is attached to one another. Okay, in the 22 bones, the 21 bones are fused together. The one bone is not fused, that is our mandible. Okay, the movable joint in the skull. It is a question where we get it in an interview, or sometimes we may get it in the ICD question paper also, I think, like the movable joint in the skull. Okay, so the movable joint in the skull is the mandible. So as I told, there are 22 bones, in the 21 are fused and one is not fused, that is mandible. Okay, so this is the main thing. Then the superior portion of the skull. Superior portion of the skull means, superior means what it is? Above. Okay, so hope everyone have gone through that human body orientation classes. If someone has not gone through that, just go through the human body orientation, so that you will be easily knowing what is the superior, inferior, like body planes, directions, all those things we have explained in that session. So if you go through that, it will be very easy. Okay, so here superior portion of the cranium. Okay, superior portion of the skull is known as the cranium, which supports or which covers the brain. Okay, coverage of the brain is called as the cranium. How does it covers? For example, if some person is getting a blunt injury or a huge trauma to the head. Okay, person is getting a head injury. In that case, what happens is directly the brain doesn't get affected, isn't it? So in that case, the cranium prevents or the cranium protects the brain. Okay, so the protective coverage of the brain is cranium. Okay, and in the inferior part is the facial bones. In the facial bones, what does this facial bones do? This supports the eyes, nose, mouth and all these adjacent organs. Okay, so in skull, the main things what all you are supposed to know is there are 22 bones and 21 are fused and one is not fused, that is the mandible. Superior portion is cranium which covers the brain and the inferior portion is the facial bones which supports the eyes, nose, mouth, all these organs. Okay. So the next one is the hyoid and the auditory ossicles. What is this hyoid? Hyoid is a U-shaped bone. Okay, it is very important. It is a U-shaped bone. It is seen just inferior to our mandible. Okay, it is seen just inferior to our mandible and it is a floating bone. Okay, these are the main peculiarities. It is a U-shaped bone. It is seen just inferior to our mandible and then the next one it is a floating bone. Okay, so this is the hyoid bone. And the next one is the auditory ossicles. What are these auditory ossicles? These auditory ossicles are the malleus, incus and stapes. These are the smallest bones in the human body. Malleus, incus and stapes. Together we call it as MIS, M-I-S. Okay. It is seen in the inner ear, inside our ear. What does this auditory ossicles do? This will transmit the sound waves and it amplifies it. Okay. That means if someone is speaking, what happens? That waves will come to our ear, isn't it? And this waves will be getting transmitted as sound waves and it gets amplified and then we will be able to understand that what the other person is talking, isn't it? So this is the function of this auditory ossicles. So what are these auditory ossicles? Which are they? Malleus, incus and stapes. These are the smallest bones in the human body and what does they do? They transmit the sound waves and amplifies it. Okay, so this is nothing but the auditory ossicles. Now comes the ribs and sternum. I'll talk together regarding this ribs and sternum. What is sternum? Sternum is the middle portion of the chest or we call it as breastbone also. Okay, the other name what we call for sternum is the breastbone. Okay, now how this breastbone and ribs are attached? That means the ribs are attached to this sternum or the breastbone. That's why I told I'll talk together this breastbone and the ribs. Okay, so this comes in the middle portion or in the thoracic cavity. Where is the thoracic cavity situated? It is just below our neck, above our abdominal cavity. So the sternum is a knife-shaped bone. Okay, knife-shaped bone. If you search in the Google, you will get the shape of the bone. If you search sternum, you will get shape of the bone. That time you will easily identify the shape. Okay, it is generally speaking, it is known as the knife-shaped bone. Okay, and also it is called as breastbones. Okay, so now comes the ribs. We have 12 pairs of ribs. Okay, in that we have true ribs, false ribs and floating ribs. Okay, now I'll tell you which one is true ribs, which one is false ribs and which one is floating ribs. Okay, 1 to 7. As I have told you, there are 12 pairs of ribs. Okay, so 1 to 7 is known as the true ribs because they are directly attached. The cartilage is directly attached to the sternum or the breastbone. That is the reason why they are called as true ribs. Okay, which are true ribs? Number 1 to number 7 are called as true ribs and 8, 9 and 10. Okay, these bones or these ribs are attached to the 7th rib. That means these ribs are not attached to the sternum. These ribs are attached to the 7th rib. Okay, that's why these ribs are called as false ribs. Okay, and now comes the 11th and the 12th rib. These ribs are known as the floating ribs. Okay, so it is an interview point of view question. You should know which one is the floating rib. Don't get confused with the false ribs and the floating ribs. Okay, so 1 to 7 is known as the true ribs, and 8, 9 and 10 are the false ribs, and 11 and 12 are the floating ribs. Okay, hope so it's clear. So we covered till ribs and sternum. Next comes the vertebral column. What is the vertebral column? Vertebral column is nothing but our backbone, where the spinal cord passes through, isn't it? In that, one lubricant fluid is there. It is known as cerebrospinal fluid. Okay, CSF. So the backbone is nothing but the vertebral column. How many bones are there in the vertebral column? There are 33 bones in the vertebral column. So for that, to easily remember that, I'll tell you one formula. It is C7, T12, L5, S7 and C4. Okay. Each alphabet indicates one abbreviations. I'll tell you what it is. C7 means it is cervical 7. What is cervical? Cervical is the neck portion. Okay. The vertebrae which is situated in your neck portion is known as the cervical vertebrae. 7 means the number of bones you have in your cervical vertebrae. That means you have 7 vertebrae in your cervical region. Okay, C1, C2, C3, C4, C5, C6 and then comes C7. Okay, that is the reason why they have given this formula like this. That means it is C7 means cervical region, 7 vertebrae are there. Got it? Then comes T12. T12 means it is thoracic. What is thoracic? Below the neck, above the abdomen. Thoracic region we have 12 vertebrae. Okay, so the next one is the sacrum and coccyx. So after the lumbar, it will be the sacrum and the coccyx. Sacrum and coccyx is the fused bones. It is the tailbone. It is also known as the tailbone. S7 and C4. Okay, so these are the fused bones known as tailbones. Okay, so for easy remembrance, try to remember this formula. C7, T12, L5, S7 and C4. C stands for cervical, T for thoracic, L for lumbar, S for sacrum and C for coccyx. Okay, so these are the main things which comes under the axial skeleton. Hope it is clear. Then the next comes the appendicular skeleton. In appendicular skeleton, actually this upper limb and pectoral girdle, these both will come together. Okay, while writing I just wrote up and down. This upper limbs and pectoral girdle will come together. Then the lower limbs and the pelvic girdle, both this comes together. So first we will discuss regarding this upper limb and the pectoral girdle. Now what is this pectoral girdle? Pectoral girdle means it is somewhat here, like the clavicle and the scapula. This midpoint is known as the pectoral girdle. The joining of the scapula and the clavicle. Clavicle or is the beauty bone, which we call like collarbone and all we say. Okay, so the clavicle and the scapula, this is called as the pectoral girdle or the shoulder girdle. Okay, and here comes the shoulder joint, and this is our upper arm bone. This is humerus, and here it joins with the elbow joint, which is flexible, which helps us to do flexion and extension. So from shoulder joint comes the elbow joint. From here it goes to the radius and ulnar bone. From elbow it goes to the radius and ulnar bone. Then comes the wrist joint, where we tie our wrist watch. So the wrist joint. Then from wrist joint goes the carpals. From carpals, metacarpals, and then comes the phalanges. Phalanges are on our fingers. On each finger we have 3 phalanges, 1, 2 and 3. But on the thumb finger we have only 2 phalanges. Okay, so this is nothing but the upper limb and the pectoral girdle. So it comes the clavicle, your scapula, shoulder joint, then your humerus, then your elbow joint, then radius and ulna, your wrist joint, then comes the carpals, metacarpals and phalanges. Okay. So the next one is the lower limb and the pelvic girdle. Pelvic girdle is nothing but a pelvic bone or the hip joint. Okay. From hip joint, our femur bone starts. That means our thigh bone or the longest bone in the human body. This is a 1 mark question. Longest bone in the human body is the thigh bone. Okay. It starts from the pelvic joint and it joins with the knee joint. Okay. So there is a kneecap called as patella. The one thing I'll tell you, patella is not completely developed in newborn babies. Once they start crawling and all, it automatically gets developed. Okay, so it's also known as sesamoid bone. Okay, based on the shape, it is known as sesamoid bone. Okay, so the pelvic girdle, then comes our femur or the thigh bone, then our knee joint. From knee joint, tibia and fibula. Okay, tibia and fibula below our knee. Then comes our ankle joint. Okay, where we put our anklet. It comes as the ankle joint. Then comes our tarsals, metatarsals and phalanges. On hands it is known as carpals and on legs it is known as tarsals. On foot it is known as tarsals, metatarsals and phalanges. Okay, so these are the main things which comes under the skeletal system, the axial skeletal system and the appendicular skeletal system. Okay, so we'll move to the other points. Okay, so the next point is like types of bones. Type of bone means it is mainly of 4 categories. Sorry, I have missed to write one point in this. Mainly it is long bones, short bones, flat bones and irregular bones. Okay, in long bones, one of the example is like femur bone. When I have explained you regarding the appendicular skeleton, I told you regarding the thigh bone. Okay, the longest bone in the human body. So it is the femur bone. Then comes the short bones. In the wrist, after the wrist joint comes the carpals. Okay, so the carpal is one of the example for the short bone, and comes the flat bone is the frontal bone. In the cranium, here we can see the frontal bone. The shape is flat. Okay, that is the reason why we call it as a flat bone. And then comes the irregular bone. What is an irregular bone? Irregular bone, it is an example when I give you is a vertebra. Okay, vertebra is an example for a irregular bone. Okay, so these are the types of bones: long bones, short bones, flat bones and irregular bones. Okay, then comes the functions. The main function is like support and protection. What is support and what is protection? Okay, when we think about the skeletal system gives us a framework for our body, isn't it? With that skeletal system only, the basic structure has been formed for our body. Along with that, when muscular system comes, we will be able to move out easily. So this is the skeletal system, the support system. And what is protection? How does the skeletal system protects us? As I have explained you in the axial skeletal system, cranium protects the brain. Okay, in the same way, there are many organs, many structures which protects the internal organs, like a rib cage protects the lungs, cranium protects the brain. When there is an external injury happening, it will protect the internal organ which is inside that outer covering. That is the reason why we call it as the function as protection and support. Okay, so the next point is like movement. As I have told you, with the basic framework, when the muscular system is involved, we will be easily able to move out. In this, I just want to include one point like articulation. What is articulation? Articulation is nothing but joint. Okay, how does this joint happens? I'll tell you. If we take this shoulder bones, it is like ball and socket joint, isn't it? Then this ball and socket joint, how does this moves? If this is the head part or this is the shoulder part, this will be the joint. Then it comes like this, then it can freely move like this. Okay, so this is nothing but called as articulation. That means the joint which helps to move easily. When we think about our upper arm, it is shoulder joint and the elbow joint, and the wrist joint is also an articulation. Okay, the next one is hematopoiesis. What is hematopoiesis? Hematopoiesis is nothing but the red bone marrow in our body produces RBCs and WBCs. And where does this produces? It gets produced in the bone cavity, in the joint cavity, in the medullary cavity. Okay, as I have shown you here to rotate the bone, there should be a lubricant. Okay, the bone marrow acts as a lubricant to articulate or move the joints. Okay, in that case, the red bone marrow produces RBCs and WBCs. This particular process is called as hematopoiesis. Okay, one thing I'll tell you, in kids, okay, the red bone marrow, the RBC WBC count will be bit high. Why? Because the growth and development in the kids are very rapid. Okay, till puberty, the growth and development is very rapid in the kids, and once the baby attains the puberty, okay, or once the child attains the puberty, it starts falling into the normal value as a normal adult. Okay, so to enhance or to be along with the rapid growth and development, the RBC and WBC will be a bit high. The red bone marrow will produce a bit more amount of RBC and WBC in childhood. Okay, once they attain the puberty, it falls back to normal. This is nothing but hematopoiesis. Then comes storage. What does the bone usually store? Calcium and minerals. If there is a calcium deficiency, what happens? Our bone gets weak, we get osteoporosis, we get many disease conditions. Okay. And the next, these are the main things comes under the functions. The support and protection, movement, hematopoiesis and storage. And next comes the parts of the bone. Okay. We just tried to draw a bone. Okay. So this is the head part of the bone and the middle part is known as the shaft. And here I have written as epiphysis. What does this epiphysis means? Epiphysis means, epi means it is on and physis means to grow. That means on to grow. The upper part of the body where the length of the bone increases. Okay. And what is this diaphysis? Diaphysis is nothing but passing through. Okay. That means the middle portion of the bone. And here comes the metaphysis. This is nothing but the epiphysis and diaphysis grow towards one another and eventually fuses to one bone. That is nothing but this metaphysis. So these three terms are very important: metaphysis, diaphysis and epiphysis. Okay, so these are the main parts of a bone. Okay, so today we have covered skeletal system. So in that mainly we have dealt with axial skeleton and appendicular skeletal system. That is very important. You should know what all things in that vertebral column formula is very important. Then we have dealt with this types of bones, functions of bones and parts of bones. The one thing what I want to quote you is the disease conditions, mainly the fracture. What I want to take is this topic will go more lengthier. So what we have planned is we will take separately fracture, the types of fractures, then the fracture care, all these things we will take it as a separate video and we will upload it. Okay, so today that's it. Keep on watching our videos. If you have any doubts, don't hesitate to ask us on millicentmom08@gmail.com. And as I have told, there is a WhatsApp student group and we are providing study materials, all those things to them as much as we can. So keep on supporting us, guys. Please like, share and subscribe our video. So catch you guys. Bye.
ഞാൻ വിചാരിച്ച തീർന്നു പോകുന്നു ബാറ്ററി.